Hi, everyone. I think we're just going to go ahead and get started. We're at noon, scheduled time for this challenge set review. So thanks everybody for participating. Um, if you have any questions or comments as we're going through this, feel free to just jump on in and ask. I'll try to move slow enough to give you an opportunity to interject. But so this was the spring challenge set. This is a review. I know it says April, but sometimes it's tough to keep things on schedule here. So here are the labs. There's a map of where we are, who participated. We have a nice spread across the state. I think we lost one lab from last time, but hopefully they'll be joining us in the fall. Here's a quick overview of the biochemical tests we're running. All labs have the capacity for gram stains, catalase, oxidase, and beta-lactamase, and then some different capacities for urease indole, motilities, and growth. We have the uh, penicillin and amoxicillin resistance tests on here. I know not a lot of people do them. They are ASM. They're part of the ASM rule outs. And so I think moving forward, we're going to start leaning more heavily on the ASM guidelines, just because we want to be giving you guys all of the information to be able to do your rule outs safely. So there will be more to that, more to come on that. And so then here we go. Our first challenge set was, I got 2024 up there, but that's okay. 56-year-old male with type 2 diabetes, COPD, he's a former smoker, presented to the emergency department with a 4-day history of worsening productive cough and a fever, shortness of breath and fatigue, reported increased sputum production, which was thick and yellow-green, experiencing chest discomfort and mild wheezing. His white blood cell count was elevated and neutrophilia was noted. A sputum was collected for culture. So if we start with our gram stain here, these are our responses. Most labs agreeing that this was gram negative coccobacilli. We had a couple calling bacilli, or I guess one calling just regular bacilli and diplococci. Here is a gram stain of our organism. Looking at this, I'd be inclined to agree with those who responded gram negative coccobacilli. These are very, very small. I know sometimes with the coccobacilli, you do see one or two kind of lengthier ones, but just these are very tiny little gram negative rods. And so in our flip chart, we have 3 gram negative coccobacilli that concern us: Francisella, Brucella, and Burkholderia mallei. We'll go on to plate growth here. So here's our chocolate plate at 24 hours. A little bit of growth starting to happen there. Our blood plate, outside of a little couple of streaky stuff in the primary, there's no growth on the blood plate. Same thing for the MacConkey, just a little bit of those tiny pink little streaks, which I wouldn't even qualify as actual growth. And that was reflected in our survey response. Most labs responding no growth on the blood, all labs responding growth on the chocolate, and everyone agreeing that there was no growth on the MAC either. And then we'll take a quick look at our 48-hour plates, see if anything changes. Growth is a little better on the chocolate. Looks pretty much the same on the blood. And again, not a lot of change in the MacConkey either. So we have our 3 gram negative coccobacilli. Is there anything we could use to narrow down our choices at this time? So according to our rule out pages here, Brucella and Burkholderia will both grow on the blood. Francisella will not, and that's what we saw with our plate growth. Saw no growth on the blood. At 24 and 48 hours. Similarly on the MacConkey, Francisella is fastidious. It needs cysteine for growth, and so that's why it grows on the chocolate, but not the blood. So, yeah, we'll follow along with our rule outs for Francisella. Um, so we had no growth on the blood or the MacConkey. It's a gram-negative coccobacilli. We've moved our work up to the hood. Next up, we're going to start our biochemical testing, which would be our oxidase, tube catalase, and beta-lactamase. And so we'll just take a look at what we said. So we had a majority of labs. We got an oxidase positive. 4 of them said oxidase negative. Of the labs who performed the catalase, everyone said that was oxidase or catalase positive, excuse me. And then of those performing beta-lactamase, they also got a positive. We'll have a look here. So here is our oxidase test compared to the controls on the left. You can see some really deep blue staining up in the right kind of middle quadrant of that circle. So we're going to have a positive oxidase test. Our catalase, you got some bubbling going on in there. Call that a positive catalase test. And then beta-lactamase, if you can compare it to the positive control on the far left, that's definitely a positive test. And so if we look at our rule out algorithm, Francisella is oxidase negative, tube catalase weak positive, beta-lactamase positive, and what we saw here was oxidase negative, weak positive, beta-lactamase positive. So if you look to the left there, that green diamond, if you did have a positive oxidase test, you ruled out Francisella, and perhaps you want to consider Haemophilus. And here were our responses. We had an even split here. I had a note here because we are missing one response. So we had 5 labs saying non-BT culture, 6 labs suspecting Francisella, and then one that I didn't get onto this list here was 1 lab suspecting Burkholderia mallei. So the oxidase test, which all labs have the capacity to perform, could have ruled out Francisella for you. So yeah, are there any questions for the first one? Oh, this was Haemophilus influenza, by the way. All right, if there's no questions, we'll go on to the second. We got a 61-year-old male presenting to the emergency department with a 1-week history of high fever, severe headache, and productive cough with greenish sputum. He reports feeling progressively weak and fatigued with no improvement despite over-the-counter medications. He denies excuse me, any recent travel. Outside the United States, his temperature is 104.4, and he is admitted to the hospital with suspected severe community-acquired pneumonia, and a blood culture is collected. So we will start up top here with the gram stain. This was our gram stain. Looks gram negative again. Let's check our responses here. So everyone agreeing that this was gram negative, and then we had some mixed results. Majority saying gram negative bacilli, gram negative rods. A handful of labs saying gram negative coccobacilli. Then we had the cocci and diplococci. So if we're looking at this, definitely gram negative. I think everyone is correct there. I think, I don't think, this is definitely a gram negative rod because most of these are at least twice the length of the gram negative coccobacilli that we saw with the Haemophilus. Definitely consistently a lot longer. Not as long as some of, like maybe an Enterobacterial, that you might see, but lengthier than a gram-negative coccobacilli. So on our list, we have our 2 gram-negative rods, Burkholderia pseudomallei and Yersinia pestis. Here's our rule outs here. So now I want to ask again, is there any kind of observation or test option that could help us limit or narrow down um, to help us choose a path that we want to take between these 2 organisms? Okay, we'll come back to that. So first off here, here's our 24-hour growth on the chocolate. Growth in the blood, so not super strong, healthy growth. And then MacConkey, not a lot happening at all. That was pretty consistent with everyone's responses. For this, everyone agreed there's good growth on chocolate and MacConkey and blood. Here's our 24 hours, chocolate and blood, and still MacConkey looks the same. And what did we say about the hemolysis? Majority, half the lab said we had some beta hemolysis. Um, and then one lab said alpha hemolysis, and then we had no hemolysis. Here is an up close picture of our organism. Um, it's it's subtle, but this organism can be beta hemolytic. It just kind of really tightly hugs the zone of hemolysis, just tightly hugs the colony itself. And then everyone said no growth in the MacConkey, which is correct. So there's our MacConkey plate at 24 hours. Okay, so now, sorry, I want to come back to this question that I had. Is there a test that could help us eliminate one of these organisms, help us narrow down our choices so we can kind of follow along the correct algorithm? So if we're looking at once we reach our biochemical testing here, we look at the oxidase test. Yersinia pestis is negative and Burkholderia pseudomallei is positive. So that's immediately going to eliminate one of our choices here. So let's have a look at our oxidase test. Um, Again, subtle, a little difficult to tell, but if you look in that gray spot in the test on the right here, you can see some kind of bluish purple. I wonder, hold on a second here. Aha. You can see some kind of purple coloration right in there. Um, so I would say that this had a positive. I need to turn that off now. Okay, so a positive oxidase test. And what did we all say? We had 7 labs that said positive oxidase test, and it was subtle. So maybe that's why we had a couple of these labs reporting a negative oxidase. Um, but that's going to eliminate Yersinia pestis from our choices here. Burkholderia pseudomallei is oxidase positive. So then if we move on with the rest of our biochemical tests, um, we've got tube catalase, indole, and tube motility for our rule out. So here's our catalase. Um, doesn't look very positive. I'd probably call that a negative test for catalase. Indole. So you see we're looking for kind of a blue coloration. This is for the indole that we use here. The indole you use in your lab might be different, so be sure to run your QC. Um, but our indole gets kind of that bluish hue on the left, and maybe it looks a little more pink when it's negative on the right. So we had a negative indole test. And then a motility. I know this is that REMO motility that gets difficult to discern. But if you look at our controls on the left, the positive on the far left, you kind of get that white cloud as it disperses from the main streak there. Um, our actual test on the right, I interpret as a negative test. It's pretty clear. There's some bubbles in the middle, but I don't see a lot of actual movement through the gel. And so here were the responses for the rest of our biochemical tests. Everyone who did the test agreed that this was catalase negative. Um, Same thing with the indole and the motility at 35. Most agree that this was not non-motil. And so using those results, we had a negative catalase, we had a negative indole, and we had a negative motility. So based on the catalase and the motility, we can rule out Burkholderia pseudomallei. Um, you can see that there are a couple more organisms up there. It says considered maybe B. mallei, Brucella, francisella. So just be sure you've done a thorough rule out process for all of those organisms as well. Then here were our responses. We had 8 labs who were able to rule out uh, Burkholderia, pseudomallei, a couple who weren't. This gram-negative Coccobacillus at the top there, if you would have interpreted the gram stain as a gram-negative Coccobacillus, you might have ended up at Burkholderia mallei. Any questions after number 2? Okay, so that the organism there was a Kingella kingae, which is slightly beta hemolytic. It's a gram-negative rod that doesn't grow on the MAC. So, okay, last one. 63-year-old female in the emergency department, sent from her doctor's office with worsening shortness of breath, a non-productive cough, and increasing bilateral peripheral edema. She had a kidney transplant 14 years prior and is on immunosuppressive therapy. Blood cultures were drawn and returned positive on day 4. Excuse me. Okay, so let's have a look at our gram stain. So these might be interpreted as even slightly bigger than the last gram stain that we looked at. They're a little plumper, maybe just about the same length. Definitely bigger than the gram-negative Coccobacilli we saw in the Haemophilus in number 1. We'll see how we interpreted these. Pretty strong conviction that this is a gram-negative rod. Again, we had one lab answering Coccobacilli, and these are short, but you know they're bigger than the Haemophilus we saw in the first challenge set. So I'd call these, yeah, short, plump, gram-negative rods. Which brings us back to our 2 gram-negative rods, Burkholderia pseudomallei and Yersinia pestis. Here's our growth at day 1, kind of tiny, growing on the blood, and growing small, tiny little lactose fermenter on the MacConkey. So, and that is pretty much everyone agreed there. Everyone saw pretty similar growth on the blood, chocolate, and MacConkey. Here's day 2. Blood getting bigger. MacConkey, still not a lot of strong growth. Lactose fermenter. Non-hemolytic on the blood. I agree with that. We've had majority of labs saying a lactose fermenter. We did have the one lab who did not see growth in the MacConkey. And here's our growth. If it's small like that, it kind of gets like we saw with the Haemophilus, where you might get some pink streaking, even though it's not, actually going to grow that well in the MacConkey. But at 48 hours on this one, we saw some colonies starting to pop up outside of the primary streak. So I would ask you what tests we could use to differentiate these two again, but I already gave you the answer in the first one. So if we look at our oxidase for this one clearly oxidase negative. Didn't even see any kind of coloration on the filter paper there. So here's what we had. Majority of labs who performed the test agreed. It's oxidase negative. So that's going to send us down the route of Yersinia pestis. If we're going strictly on biochemical tests, next up we're going to do our catalase, our indole, our urease, and then tube motility at room temperature and at 35 degrees, which is important distinction. So here's our catalase test on the right. That's clearly positive catalase. Indole looks negative. Here's our urease, starting to get a little pink coloration there. So we call this a positive urease test. Sorry for the photo quality there. We're still trying to figure out a good method to get pictures taken of these tests. And then here is our motility at 25 degrees. It's kind of hard to tell in here, but it is a little more difficult to see the background of this. Wait, where's my... To see through this, on this one, you can kind of see some of that pattern through. You kind of lose it in the middle here. Similar to over here. Here's our tube motility at 35 degrees where, now it starts to get a little clearer through the center there. So we'd interpret this as motile at room temperature and non-motile at 35 degrees. And to back that up, we did this with our NPHL motility, where you can kind of see some diffuse growth growing off the edge of our streak in our motility there. And then here's our 35 degrees, just nothing in the middle there. So again, we call this motile at room temp and non-motile at 35 degrees. Let's see how the labs did. So everyone pretty much agreed we had a positive catalase. Indole, we had some mixed results. We had more positive urease than not, and more labs that didn't perform it. Then we had more labs perform a motility at 35 degrees, just one who did a motility at 25, and that the lab who performed the room temp motility found it to be positive. We'll talk about that in a second. So for our Yersinia pestis, we had an oxidase negative, catalase positive, indole negative, urease positive, tube motility positive at room temp and negative at 35 degrees. So our urease has ruled out Yersinia. And as far as the Yersinia species go, Yersinia pestis is non-motile at room temperature and 35 degrees. Things like Yersinia intermedia and other Yersinia species will be motile at room temp. So that's why if you're going to do the motility here, you need to be sure to set it at both room temp and 35 degrees because all Yersinia are going to be non-motile at 35 degrees. The heat affects their motility. So now that we've said that, so we've ruled out Yersinia. Majority, half the lab said non-BT culture. We had a few who were unable to rule out Yersinia. We had a couple who had a urease negative result, and a couple who didn't really lean on the motility that much. Francisella would have maybe come from calling this a gram-negative coccobacilli because it was oxidase negative. And so any questions for number 3? We're going to end just about a half hour here without questions. This was a Yersinia intermedia. I think, so before I keep speaking, are there any questions, comments, or concerns? Okay. So I think what I might do here is I might do an individual write-up for all of our participating laboratories. It's like something like, here was your response. Here was, what was intended. because I noticed that, when we just throw up everyone's results on the screen like this, uh, you might not get as much, there might not be as much to take away from that. We can continue to do these sort of group reviews if everyone would prefer, but I think moving forward, I'll be sending individual feedback for the laboratories. If anyone has any opposition to that, or I don't know, any comments or anything about that, feel free to get a hold of me. I'm just trying to find ways to make the challenge set, as worthwhile as possible for you. Okay. Thank you, Rebecca. Yeah, I just want all of you to be able to take away, more from it. So I'll get working on that. And I'll send them out this time. So yeah, you can kind of see maybe where your line of thinking was incorrect. And and then we'll just keep going, send them back out in the fall. And um, I mean, I appreciate everyone's participation. I think, yeah. So I guess that's all I have now. If anyone else has anything else, otherwise I'll let you go.
Ben, this is Rex.
Hey, Rex.
Thank you for that, because we can use this for our QA, QI process as a
Yes.
improvement, and the individual write-up would really help.
Oh, perfect. Okay. So it sounds like from what I've heard, it sounds like the individual write-up is getting favored. So I'll go ahead and put that together, and I will try to get it out soon. I don't know if I can get it out this week for each of you, but I'll do that. So that's how we'll move forward for this. Okay, well, that's all I have. So thanks everyone for joining and listening. Um, yeah, get prepared or keep doing what you're doing. You guys are doing a great job out there. Thanks.